we don't really have any protection.
So the title of my article is that estrogenic chemicals in plastic and oral contraceptives disrupt development of the fetal mass, prostate, and urethra. The original purpose was based off of studies from about 60 years ago. So they had speculation that exposure of male fetuses to elevated estrogen levels in utero could predispose men to having an enlarged prostate in old age. And there was other studies that show that high doses of diethyl stilbestrol, which is also called as DES, inhibits prostate development in mice and rats. So the first one says that it's comparing it to low levels of estrogenics, and then high levels of estrogenics causes low growth. So this is more recent. They wanted to look into how oral contraceptives and plastics affect prostate and urethral development. So ethanoestradiol is often found in oral contraceptives and may affect the development of male fetuses. This occurs because women who are on birth control assume maybe that they can't get pregnant, so they keep taking the contraceptives for months after their pregnancy until they discover that they in fact are pregnant. And within the first 5 or 6 weeks, as was told, when the reproductive tract is developing and differentiating, if these mothers are still taking these estrogenic compounds, then they are affecting the development of their male fetuses. And then bisphenol A is widely used in plastics and sealants. It leaches into the food and can be exposed to pregnant women. The levels of bisphenol A in amniotic fluid during the reproductive tract differentiation were very high at 8 nanograms per milliliter. The materials, so they obviously just used lab rats that they got from a place that makes genetically engineered lab rats for use. The pregnant mice were fed soy-based chow, which I thought was very interesting, and the mice were given purified drinking water in glass bottles. So they made sure not to use any other external sources of plastic. DES, ethanoestradiol, and bisphenol A were all used separately to affect these mice. So the feeding methods, pregnant mice were fed either oil controls, which is the corn oil, or ethanoestradiol at 0.1 milligram, I don't even know, what's that?
Micrograms.
Micrograms per kilogram per day. Bisphenol A was 10 micrograms per kilogram per day, and DES was 0.1 micrograms per kilogram per day. And they were all only fed for 5 total days during gestation. And the chemicals were all dissolved in corn oil. So that was the initial study about the low doses, how a low dose affects the prostate and urethra. And then the separate study is that pregnant mice were fed oil controls or a high dose of DES at 200 micrograms per kilogram per day. This was just done to compare what a high dose does versus a low dose in terms of growth. And then in immunocytochemistry, the proliferating cell nuclear antigen was used. Tissue sections were labeled with an antibody to PCNA, which is a marker of proliferative activity. It's with the tissue growth, the regular tissue growth. So the low dose is going to affect it one way, the high dose is going to affect it in a different way. And then the estrogenic chemicals impact the number of proliferating cells. And mouse keratin 5, MK5, is a marker of basal cells that was used as more of a control to see if these proliferating cells were growing, were the basal cells also growing. And these are the results of the high-dose test. A high dose of DES does in fact inhibit prostate morphogenesis. It inhibited the formation of ducts in the prostate. Elongated ducts in normal growth were abnormally short, and the reduced size of seminal vesicles, vas deferens, and urethra can be seen. So if you look at A, these are the ones that underwent the chemical treatments, and B is the controls. I think. Because these have shortened.
Right, A is the,
These have
Yeah.
These have the abnormal.
it's looking at two
structures.
views, side and,
Mhm. These have the abnormal structures.
yeah.
So the elongated ducts here and here are abnormally short. They don't have the same curvature. And some of the structures are have even disappeared. So this structure here and here and here are not, which is the glands and ducts of the prostate.
Right.
And this is the low-dose results. Low doses of estrogenic chemicals stimulate prostate duct development, and they also cause urethral malformations. These are the table of doses that the most were given, and then once the fetuses were extracted via cesarean section, they had their prostates removed and measured for duct volume. And the control, as you can see, has fewer ducts than each of the low doses, so they cause increased growth of the prostate.